Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Wechsler Adult Intelligence Scale assesses cognitive functioning in adults across multiple domains. It measures verbal comprehension, perceptual reasoning, working memory, and processing speed. These domains reflect core aspects of intellectual ability. The main purpose is to identify intellectual strengths and weaknesses. The tool aids in diagnosing conditions such as intellectual disability, traumatic brain injury, and neurodegenerative disorders. It provides standardized scores that assist clinicians in formulating treatment plans and educational interventions. The assessment is widely recognized for its reliability and validity in clinical and research settings. The Wechsler Adult Intelligence Scale is indicated for adults aged 16 to 90 years, suspected of cognitive impairments or intellectual functioning deficits. It is most useful in clinical contexts involving neuropsychological assessment following brain injury, stroke, or neurological disorders. The scale aids in diagnosing intellectual disabilities, dementia, and other cognitive disorders. It also supports evaluation in psychiatric conditions such as schizophrenia and major depressive disorder. The tool provides standardized measures of verbal comprehension, perceptual reasoning, working memory, and processing speed, facilitating comprehensive cognitive profiling. The clinician begins by administering the Wechsler Adult Intelligence Scale in a standardized setting using the complete battery of subtests. The scale consists of 10 core subtests and 5 supplemental subtests, covering verbal comprehension, perceptual reasoning, working memory, and processing speed. Examples of subtests include vocabulary, similarities, block design, and digit span. The examiner presents each item verbally or visually, depending on the subtest, and records responses according to the manual instructions. Response formats vary. They include spoken answers, pointing, or manipulating blocks. Each item is scored as correct or incorrect, and raw scores for each subtest are converted to scaled scores based on normative data. The scaled scores are then combined to yield composite scores. Verbal Comprehension Index, Perceptual Reasoning Index, Working Memory Index, Processing Speed Index, and Full-Scale Intelligence Quotient. Normative reference ranges are based on a mean of 100 and a standard deviation of 15. Scores between 85 and 115 are considered average. Scores below 70 indicate significant cognitive impairment, while scores above 125 suggest superior intellectual ability. Interpretation must consider age-based norms, education, and cultural background. The final report details strengths and weaknesses across cognitive domains to inform clinical decision-making. Sensitivity refers to the ability of a test to correctly identify individuals with a particular condition, while specificity indicates the test's ability to correctly exclude those without the condition. The Wechsler Adult Intelligence Scale demonstrates variable sensitivity and specificity depending on the cognitive impairment or disorder being assessed. Studies indicate that the sensitivity of the scale in detecting intellectual disability ranges from approximately 0.75 to 0.85, meaning it correctly identifies 75 to 85% of true cases. Specificity tends to be higher, often exceeding 0.85, which implies that over 85% of individuals without intellectual disability are correctly recognized as not impaired. For example, in a clinical assessment of mild cognitive impairment, a sensitivity of 0.8 would ensure that 80% of affected individuals are detected, while a specificity of 0.9 would mean that 90% of unaffected individuals are accurately classified. These metrics allow clinicians to interpret the scale's results in the context of diagnostic accuracy and to balance false positives and false negatives in cognitive evaluations. Wechsler Adult Intelligence Scale was originally developed by David Wechsler in the mid-20th century to provide a comprehensive assessment of adult intelligence through both verbal and performance tasks. Its validation framework has been extensively documented through numerous normative studies and psychometric analyses. Initial standardization samples included large, demographically diverse populations to ensure representativeness and reliability. Subsequent revisions, such as the 4th edition, incorporated confirmatory factor analyses to refine the underlying cognitive constructs measured, including verbal comprehension, perceptual reasoning, working memory, and processing speed. Research conducted by Wechsler and colleagues demonstrated strong test-retest reliability, coefficients often exceeding 0.9, alongside internal consistency values generally above 0.85, supporting its stability and coherence as a measurement tool. Concurrent validity has been established through correlations with other established intelligence measures, while predictive validity has been supported by associations with academic achievement and occupational performance documented in longitudinal studies. Cross-cultural adaptations and validations have further reinforced the test's robustness and applicability in varied populations. This cumulative body of evidence underscores the Wechsler Adult Intelligence Scale's status as a scientifically grounded and empirically supported instrument in psychological assessment. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.